Good morning, everyone, and welcome to day 2 of the 3rd annual Native American and Rural Emergency Medicine Conference in virtual format for the 2nd year in a row. My name is Sean DeAndre. I'm the co-founder of the Native American Emergency Medicine Consortium and the Chief Clinical Consultant for Emergency Medicine for the Indian Health Service. I want to thank everyone for taking time out of their schedule to join us today for our second roughly 4-hour block of content for the conference. We want to start by talking about and acknowledging what a difficult and challenging year it's been, particularly for those in the healthcare space, as well as those who live and work in Indigenous and rural communities. So this conference is dedicated to all the healthcare professionals who have and continue to serve Indigenous and rural communities, and to all of the individuals and communities impacted by the COVID-19 pandemic. And as we started yesterday, we want to invite everyone to participate in a moment of silent reflection before we get started for the conference today. Thank you, and thank you all for the work that you have done and continue to do in whatever community that you do serve. And we hope everyone who's joining us today is doing well. It's been an incredibly difficult year for everyone. And there's really no other way we could think to start the conference than to acknowledge that. I want to talk quickly about our partners and the support we've received. And we're going to start today's session by sharing the stage with our co-coordinators, our co-leaders in this conference, those folks from the Frontline Indigenous Partnership based in Boston. You're going to hear from leadership there and from the entire team. In fact, the Native American Emergency Medicine Consortium is the platform from which this conference developed. Sohotso Medical Center in Fort Defiance, Arizona provides support for the website as well as hours that folks spend working on this project. Brigham and Women's Hospital, Harvard Humanitarian Initiative, and all of the friends and colleagues of the Native American and rural emergency medicine community around the country. Again, this is the 3rd year we've run this conference, and we're very grateful for those who have attended in the past and those who are joining us for the first time this year. A quick word about the Native American Emergency Medicine Consortium, which will likely be renamed sometime soon. We're hopeful of that. The NAEMC was developed and is dedicated to improving emergency care delivered to Indigenous and rural communities through education, advocacy, and collaboration. And this conference really brings together all 3 of those elements. And one of the real intentional goals of the organizers of this conference is to bring not just the basics of emergency care to this audience, but really cutting edge content. And I hope that you all agree at the end of today that the folks who have given their time to present are really bringing us the very up to the minute practice in emergency medicine to help improve the care that we provide in each of our departments. Today's agenda, I'll run through this quickly. It's a bit more of a rapid fire content compared to yesterday, which is a little more long form. We're starting today with introductions. Very shortly, I'm going to turn it over to Dr. Valerie Dobiez, the program lead from the Frontline Indigenous Partnership, to provide an overview of that program, which has really driven the development and coordination of this conference. Then we're going to hear about a case of cryoamputation in the setting of sepsis. So this is an example of a very challenging case in a setting with limited resources and limited opportunity to transfer a patient for definitive care. Something I think most participants in this call are going to be familiar with a scenario like that they've encountered. So that should be a very interesting discussion. Then we're going to hear a little bit about COVID-19 critical care and then extended critical care in the ED, another area where folks who participate in this conference likely practice in a way that's a little different from our urban colleagues, is that we're often not faced with the first 3 hours or so of care of the emergency department patient, but up to 6, 12, or even more time than that. So we're looking forward to hearing about extended critical care guidance for the COVID-19 patient. Then we're moving into the more rapid fire content and timelines for the talks. We're going to hear from Doctors Catherine Hawk and Eric Anderson about ED-based interventions for opiate and alcohol use disorder. We'll hear then from Dr. Chelsea White about emergency medical services adaptations and innovations during the COVID-19 pandemic. Then from 10:45 to 11:15, we're going to find out how best to get our patients rapidly dispositioned and transferred out of our remote EDs, followed by updates in airway management. It's been a obviously challenging time to travel for conferences. A lot of folks make it to the difficult airway course at least every couple of years. So we're excited to hear some airway management updates. And then we're going to have a video with closing remarks from ZDog MD. So I'm going to stop share now. That's what the day looks like. And it's my pleasure to introduce Dr. Valerie Dobias from Brigham and Women's Hospital, who is also the program lead of the Frontline Indigenous Partnership. Dr. Dobias and her team have really made this conference possible this year. Their support in a range of ways is what this conference is built upon. So thanks, Dr. Dobias, to you and your team. Look forward to hearing about FLIP.
Thank you so much, Sean. It is truly an honor and privilege to be here with you all today. We just wanted to give you a brief overview of who we are and our team and the purpose, since it's been mentioned several times, that we're here to support this conference and the work that you're doing. So this is our team and our program, the Frontline Indigenous Partnership. Frontline, as this is for emergency medicine healthcare providers, and very much a partnership to support you in what you do. We're an academic partner. We're based at the Brigham and Women's Hospital, as well as we are faculty, many of us at the Harvard Humanitarian Initiative. So I just have to give a debt of gratitude to Dr. Michael Van Rooyen, who is the director of our department at the Brigham and Women's Hospital, and he also directs the Harvard Humanitarian Initiative. And it is really through him that this program was started and initiated through a generous donation from an anonymous source, who really was this anonymous source motivated by the health disparities that were highlighted and brought to light, pre-existing, as we all know, with the Indigenous populations. But with COVID, these were exacerbated, and they were compelled to do something about it and donated to this program to initiate it to improve Indigenous health. And I want to acknowledge our partners who have been extraordinary through this all. Sean DeAndrea and Ken Bernard, who have a connection with the Brigham and Women's Hospital and our program. They have been incredible in this, in developing our program and our mission. So what are our goals? We want to help improve the health of Indigenous peoples. We want to collaborate as an academic partner to EM healthcare providers, very much all of you who are here and in rural settings that are serving Indigenous populations and peoples. We are going to do this through clinical exchanges, educational programs such as this. We are developing an online LMS platform and to support this conference. So we're behind the scenes to help make this run smoothly in order to help your educational programs. And very quickly, this is very much a team effort. And I want to introduce the team to you very briefly to share their aspects and what component of the program they're working on. So Andrew, would you mind sharing a bit more about what you're doing?
Absolutely. Good morning, everyone. Thanks for having us. My name is Andrew Ayer. I'm one of the EM physicians at Brigham and Women's Hospital, and I help run the emergency medicine residency. So I'm helping the team out with some of the educational components. Like Dr. Dobias said, one of the main efforts is this course. So it's been very much a labor of love with Ken and Sean to put this together. And then moving forward, we have a couple of initiatives that we're quite excited about. One is the learning management system that Valerie just mentioned, where we're working on creating not only a website that can house some valuable resources, where we can record other educational sessions. We're going to be recording this meeting and storing that and making it available to other folks as an educational resource. And then we're also working on a couple of programs moving forward for more sustained education. So one is a leadership development course or a kind of seminar, I should say, for folks who have been identified as having various leadership roles within the IHS sites to talk about various components of organizational structure, leadership, finances, kind of the issues that really are thrown at young and emerging leaders. So that's going to be one thing moving ahead. And then the other one is more of a kind of overall clinical education program, just knowing that many of you are working at sites where you don't have as easy access to routine CME or routine education. We are very lucky in the environment that we work in, where we have a lot of national and local experts. So we're hoping to have an ongoing series of educational resources. So we'll be moving forward with that. Hopefully you can expect and be willing to work with us to make those offerings as valuable to you as possible. So we'll be reaching out with surveys and a little bit of a needs assessment to try to make it as valuable as possible. And then you'll hear from us going forward. And please give us feedback as we go so that we can know how to be most useful. Thanks, Val.
Yeah, thank you, Andrew, so much. Jaylani Hall, would you mind sharing a bit about your role and what you're doing?
Of course. Sorry about that. Okay, one moment. Do you mind skipping me while I fix the audio?
Absolutely. Technology is awesome. I'm going to just mention Anna Meyer. She is not with us this morning, but she is leading our nursing exchanges. She's been very active at the Gallup program, GIMC, to help nursing establish onboarding and educational programs. So she had an emergent issue in the emergency to this morning. So she very much an integral part of our team. Jay, are you ready? I heard an hum.
My test. That was my test, yes.
Great.
So hi, my name is Jay Hall. I'm the program manager for the Office of Ideas in the Frontline Indigenous Partnership Program. I work very closely with Valerie, Andrew, Tim, Katie, Anna, and Cassandra as well to turn all of their ideas into fruition. And I am so happy to be part of this team and to see all the amazing work that the FLIP is doing, and also Native American Association, which hopefully we have a new name for that. But yeah, this is amazing to see, and thank you.
Wonderful. And Cassandra, our newest member to the team, are you available to say a few words?
Yes, I am. Good morning, everyone. My name is Cassandra. I am the program coordinator for the FLIP team. I'm so happy to be here as well. I've had an exciting 2 weeks kind of getting things going. Some of you have spoken to me. I'm the one that's been bombarding you with reminder emails. And when I'm not, I'm providing administrative and logistical support for the team. So thank you so much.
And we're delighted to have you, Cassandra. And Katie, do you mind sharing a bit about who you are and what your role is?
Sure. Good morning, everyone. My name is Katie Dickerson. I'm a keen PGY1 in the Harvard Emergency Medicine program, and I've been involved with resident education, serving as a resident liaison for the Frontline Indigenous Partnership Program. So we're working to increase educational opportunities for our residents to get involved with Indigenous healthcare, and possibly with the goal of facilitating anyone going to IHS sites later, if that is what they wanted to do.
Thank you so much, Katie. And last but definitely not least, Dr. Timothy Erickson.
Yeah, thank you, Valerie, Sean, Ken. Really appreciate you putting on this conference. I'm Tim Erickson. I'm one of the Brigham EM attendings, also a toxicologist, and also a core faculty at HHI. I am overseeing the faculty exchange between the Brigham and Fort Defiance, or CHUTSO. And it's not because they need more coverage or better coverage. They actually have superior physicians, physician assistants there. It's a chance for us to exchange some of our faculty with theirs. And we're going to learn a lot that we don't see in Boston, that you see in the Southwest. But we're really looking forward to it. We're getting our faculty in line. Thanks to Sean for really spearheading this and making it happen. We're really looking forward to and hoping by October, the fall of 21, we'll have Brigham faculty as well as residents rotating in the ED at Fort Defiance. So really looking forward to it. And it's not just clinical exchange, as Andrew said, it's educational and also academic. And most importantly, being there for the patients in need. So thanks a lot. Really appreciate the opportunity. Thank you, Valerie.
All right, so that was it, a brief introduction to our team. We're here for you to support your efforts. And thank you so much, Sean and Ken, for being such incredible partners in this. It's been truly amazing. And we were most recently established October 2020. So we're looking forward to many years of incredible work together. Thank you so much.
Thank you, Valerie, and everyone at the team at FLIP. It's impossible to overstate how helpful this partnership has been. I mean, this conference wouldn't be happening without the work of this team. As Valerie pointed out in the timeline, I think everybody realizes what we were all up to in October of 2020, and that was taking care of lots and lots of sick COVID patients. And so our bandwidth is really thinned out. Morning, Ken. How are you? Good to see you. Sorry, I didn't give a shout out earlier. And everyone, I'm just going to quickly jump back to a screen share here, because in my zeal to introduce the FLIP team, I did not address some housekeeping reminders that'll be important. But again, thanks again to FLIP for all you've done to make this conference possible. Very quickly, please keep your lines muted throughout. We are in a webinar format, so our team's going to help with that. This session is recorded, and so your attendance is basically acting as consent to be recorded. Now, the session will be available to view following today's conference, and an announcement will go out about that after the conference. We really want to cultivate a robust exchange with our presenters and the team here, so please share as many questions or comments as you have in the Q&A feature of Zoom, which can be found down at the bottom of your screen. CME, of course, is available throughout the presentations today. In the chat feature, you'll see a link to the post-session evaluation for CME credit. That'll be posted probably a couple times throughout the day, so keep an eye out for that. The link will likely be shared following each presentation or every other presentation. And we would just ask everyone's patience with any technical hiccups that we experience. We've got redundancy plans in place to deal with that, but in the event that we have challenges with connectivity, etc., please stand by and we'll work to correct those.